So let's start with hypertrophy. Hypertrophy is an increase in the size of cells resulting in an increase in the size of the organ, caused either by increased functional demand or by growth factor or hormonal stimulation. It occurs in permanent cells, non-dividing, like muscle skeletal, cardiac muscle, nervous, etc. Hypertrophy can be physiologic or pathologic. Examples of physiological hypertrophy include physiologic enlargement of the uterus during pregnancy. Occurs as a consequence of estrogen-stimulated smooth muscle hypertrophy and smooth muscle hyperplasia. In this image you can see, on the left is a normal uterus, normal smooth muscle wall. On the right is the uterus of a recently pregnant woman in which there is marked increase in the smooth muscle wall thickness. This is due to the hypertrophy and hyperplasia of uterine smooth muscle. In this image you can see a gross appearance of a normal uterus, right, and a gravid uterus, left, that was removed for postpartum bleeding. Another example is skeletal muscle hypertrophy. Occurs in response to weight training, in response to increased workload. Therefore, the chiseled physique of the avid weightlifter stems solely from the hypertrophy of individual skeletal muscles. Another example is, following surgical removal of one kidney, the other enlarges and increases its function. Pathologic hypertrophy. An example of pathologic hypertrophy is the cardiac enlargement that occurs with hypertension or aortic valve disease, in response to increased workload. In this image you can see, in the left normal myocardium, thickness 1 to 1.5 centimeters. In the right myocardial hypertrophy, the left ventricular wall is thicker than 2 centimeters. Mechanism of hyperatrophy involves gene activation, protein synthesis, and production of organelles.